One of the things that I realized when I was doing some background research is there's very few studies that have done dietary assessments in individuals that are receiving tube feedings. And that's just not just in PBD, that's all across the board, right? I think initially the sort of idea or the assumption was that, well, these kids are getting Ensure or some kind of formula, so we don't really need to do dietary assessments because we can just read the formula and just ask them how much of that formula they consumed. And that's just not the case anymore. A lot of parents are exploring things like home blending. They're finding that the home blending is a better option for their child because the formula is causing some sort of like GI symptoms or some sort of issues with their child. And they find that the home blending actually relieves a lot of these sort of issues that they're having with standardized formulas and what have you. So knowing that, that we have children that are maybe receiving home blending, or maybe they're doing a combination of formula or commercial food blend and home blending, there is a need to get a better understanding of, what is the nutrient intake of kids that are being tube fed, like a lot of our kids with PBD. And then there is some but limited data that suggests that the nutrient status of orally fed kids versus tube fed kids there may be differences there. I remember seeing a paper from several years ago that said that tube-fed kids may be more at risk for iron deficiency than kids that are orally fed. And so this was sort of the motivation of doing this study that the GFPD has funded, where we're looking at trying to establish kind of best practices for doing dietary assessments in both orally fed patients as well as tube-fed patients. But using, most of the times when you do dietary assessments, you are asking the person that you're trying to get this information from, hey, what did you eat over the last 24 hours? But we can't do that with our kids. So we ask the parents, hey, parents, what did your kids eat over the past 24 hours? And then just doing that in a methodical way and using that information to put into our software to get a really good idea of what their nutrient status is.